All right. Let's talk about some knee and leg mnemonics. All right, so we're going to first start off by talking about the knee, and hopefully we'll do a quick run through and talk about just some basic concepts to get you better acquainted with this joint. So first, let's do a quick overview of the anterior knee when it comes to the bones involved with this joint. Here is an anterior view of this knee joint, and here is a lateral view. And just looking at the bones involved in these views, we have our femur, patella, tibia, and fibula. Earlier when I said that second view was a lateral view, we know that because this fibula is fibulateral in this leg. For the knee, only the tibia and the femur articulate with the patella, and the fibula is not actually involved in the knee joint. So let's take a closer look at the patella. On the left, we have a picture of an anterior view of the patella, and on the right is a posterior view. The portion on the superior part of the patella is the base, whereas the inferior portion is the apex. The patella articulates with both heads of the femur. However, the lateral femoral head is larger than the medial femoral head, and we can see that when we look at the posterior view of the patella. If you were to take a patella bone when you're studying in lab and place it on a table, it will preferentially list towards the lateral side, whereas the medial side will be a little bit more in the air. Because of that, we say the patella lies lateral as a way to remember which side is lateral and medial. And once you figure out which side is lateral and medial, you will be able to tell if it is a right patella or a left patella. So let's talk a little bit more about the tendons of the knee. In this picture, again, to orient you, we have our femur, our tibia, and our patella. So the patella is formed within the quadriceps tendon, which we can see in this picture here. This quadriceps tendon is the distal attachment of the quadriceps femoris muscle, and it attaches to the base of the patella. On the inferior portion of the patella, we have the patellar ligament. This ligament, which can also be called the patellar tendon, attaches on the apex of the patella and proximally and attaches to the tibial tuberosity on its distal end. As a way to remember the names of these tendons, I just think if you're looking down towards your feet and you're looking at your knee, first you see your quadriceps muscles on your thigh. So that's the first thing you see. So as you're looking down, you would call that tendon your quadriceps tendon. And then you get to your patella as you continue looking down. So then once you reach your patella, then the rest of that ligament is called your patellar ligament. Now let's look at the menisci of the knee. These structures function to increase stability and act as shock absorbers at this joint. So if we have an anterior view of the knee, and we were to make a cut at the quadriceps tendon as shown and reflect the patella inferiorly, this is what we would see inside that knee joint. If we were to go further and remove the femoral condyles from the tibia and turn the tibia towards us, we would then be able to see this view called the tibial plateau, where we have our anterior portion and our posterior portion, just to help orient you in this view. When we look at the tibial plateau, we can identify our lateral meniscus and our medial meniscus as well. Our lateral meniscus is more mobile, whereas our medial meniscus is more stable. In any sort of area that requires movement, specifically in joints, we would need to have a little bit of mobility. Because we have our medial meniscus, which is more stable, this meniscus is more prone to getting injured in comparison to our lateral meniscus. So let's take a look at these menisci of the knee from a different view. So again, here's our tibial plateau on our left, and on our right we have a posterior view of the knee joint. So to orient you, we have our anterior and posterior portions of our tibial plateau and our proximal and distal regions of our posterior view of the knee joint. We can also identify our medial and lateral aspects as well. So now that we're oriented in these views, we can identify our lateral menisci and our medial menisci as well. Looking at these same views, we can also look at our ACL and our PCL ligaments. So our ACL is our anterior cruciate ligament. It attaches anteriorly on the tibia and it prevents it from moving anteriorly. In contrast, we have our posterior cruciate ligament, which attaches posteriorly on the tibia and prevents that bone from moving posteriorly. So these ligaments are named according to where they attach on the tibia. So our ACL attaches anteriorly and our PCL attaches posteriorly. Now let's talk about our LCL and our MCL. So our LCL is our lateral collateral ligament. It attaches laterally at our knee joint, and it resists varus forces, which are forces that come from inside the knee, and it places a level of stress on that opposite side of that knee joint. In contrast, we have our medial collateral ligament, which attaches medially on this knee joint, and it resists valgus forces, or forces that come from outside the knee joint, and places pressure on the inner part of the knee. A way that I remember varus versus valgus is our L at the knee joint, or L lateral, and that's how I remember valgus, and then the other side would be varus. All right, so now we're going to move on and talk about the leg. So let's just talk very briefly about compartments of the lower limb. If we have a posterior view of the leg and we were to take a cross section at this level, this is what we should see. So to orient you, we have our tibia, our fibula, and we have our anterior compartment, our lateral compartment, our deep posterior compartment, and our superficial posterior compartment. So as I always say, the key to anatomy is learning by grouping. So we're going to look at our leg by grouping all these muscles together by compartments. So first, let's look at the anterior compartment. We're going to look at these muscles all together in terms of how you might see it in a lab dissection. And we're also going to look at each muscle individually, so that way you can appreciate the attachment points to better understand their actions. So the first muscle we're going to look at is the tibialis anterior, which we can see here in both of these pictures. Our next muscle that we'll see is our extensor digitorum longus, which is just underneath that. And then our extensor hallucis longus, which is nestled right in between those two muscles and extends out to the big toe. We can also see our fibularis tertius. This is a muscle that is not present in all people, and it's a little bit difficult to see in this anterior view, so we're going to look at it from a lateral view. To orient you, we can see a little bit of the muscle belly and the tendons of our extensor digitorum longus, and to identify the fibularis tertius, we can see a little bit of a muscle that's just lateral to our EDL, and we can see a little bit of that muscle belly, and it goes down to that lateral side of the foot. So let's talk about some generalizations of the anterior compartment of the leg. So in terms of actions, generally speaking, these muscles perform dorsiflexion. They are innervated by the deep fibular nerve, and they are supplied by the anterior tibial artery. Now let's look at the lateral compartment of the leg. Here we only have two muscles. The first muscle we're going to look at is our fibularis longus. And here we are looking at the muscle in both a lateral view and also anteriorly. And then our second muscle we're going to talk about is our fibularis brevis. So just as a reminder, in the leg, as in most parts of our body, when we're talking a longus versus brevis, it's named according to the length of the tendon. So this fibularis longus has a much longer tendon, whereas a fibularis brevis has a shorter tendon. Talk a little bit more about some generalizations we can make about these two muscles in the lateral compartment. In terms of actions, there are two actions. They can do plantar flexion and eversion of the foot. So remember, with eversion versus inversion, we talk about the direction of the soles of our foot. So eversion pulls the soles of our foot outside or lateral. These two muscles are innervated by the superficial fibular nerve, and they're supplied by perforating branches of the fibular artery. Now let's talk about muscles in the superficial posterior compartment. Again, we're going to look at them compositely in a posterior and medial view this time, and also individually just from a posterior view. So the first muscle we're going to talk about is the gastrocnemius muscle, or the gastrocs. This muscle has a medial and a lateral head, and it has a tendinous attachment that inserts on the calcaneal bone, or the heel bone of our foot. This tendon can be called the Achilles tendon or the calcaneal tendon. And there is another muscle that also attaches on this tendon, and that is the soleus muscle. So if we're trying to look at this muscle individually from a posterior view, we first need to cut away the gastrocnemius in order to see the soleus in its entirety. The last muscle in this region is the plantaris muscle. It is a very small itty bitty muscle. So to orient you when we're looking at just this muscle, we have to cut away the gastrocs, and we can see the soleus underneath it, and the plantaris runs just in between the two essentially. So we have the small little belly of the plantaris here, and we can see it in the composite view. Sometimes you can see it that way in lab. Sometimes you need to dissect out these medial and lateral heads of the gastrocs to see it better. And then we can see this long skinny tendon that runs right on top of the soleus muscle. If you're in lab, sometimes the best way to identify this muscle initially is to pull away the muscle bellies of the gastrocs, identify the soleus, and then look for a long skinny tendon running in between the two and chasing it all the way up to identify the actual muscle belly. Let's talk about some generalizations for muscles in this compartment. In terms of actions, these muscles do plantar flexion. So remember the foot at the ankle joint, you can do plantar flexion or dorsiflexion. I remember plantar flexion, like if you plant your foot, if you put your foot down and you say, I'm not going to stand for this anymore. If you plant your foot, you're pushing your foot down. You're pushing the toe of your foot down, or the ball of your foot down on the ground. And so that's plantar flexion. You're planting your foot. The other movement where your toes are going up towards your shin bone, that would be dorsiflexion, the opposite movement. So remember, muscles only exert an action on joints that they cross. So our gastrocnemius muscle crosses our knee joint proximally. So because of that, our gastrocnemius muscle does plantar flexion, and it also does flexion at the knee. Now, let's talk a little bit about our plantaris muscle. We can see it has this itty bitty belly and this very long tendon. It is not a very useful muscle. Really, it's used as grafting. It's spare parts. If you need a tendon graft, great, plantaris would be perfect for that. Otherwise, it's pretty useless. I mean, it doesn't really have a function. We all have a plantaris muscle, but it doesn't really do a whole lot. I'm sure you all have some plantarises in your life, and I'm not talking about a muscle in your leg. If that helps in any way to try to remember this muscle and what it's used for and where you can find it. So all three of these muscles, they're innervated by the tibial nerve, and it gets blood supply from the posterior tibial artery. Of course, good old plantaris has an exception. It gets its blood supply from the popliteus artery. Now let's move on and talk about muscles in our deep posterior compartment. We're going to spend a little bit more time talking about these muscles. So again, we're going to look at these muscles in a composite view posteriorly and then individually as well. So to orient you a little bit, I don't have them highlighted, but here we can see we have some muscles cut away. So right here we have our medial and our lateral head of the gastrocnemius, and we can see our Achilles tendon or calcaneal tendon cut right here. So remember, those were muscles of the superficial posterior compartment, and we have to cut those away to see muscles in our deep posterior compartment. So the first muscle that we're going to talk about is the popliteus muscle. So it is located very deep on the back of the knee joint in the deep posterior compartment. Our next muscle we're going to talk about is our flexor digitorum longus muscle. And we're going to also look on the sole of the foot, and we can see the tendons wrap around and extend to the distal phalanxes of the toe. Our third muscle is our tibialis posterior muscle, which if we're looking at our view down here, where we're trying to look at the muscle individually, we will have to cut away our FDL in order to see the entirety of our tibialis posterior, since it is deeper to that. And finally, our last muscle is our flexor hallucis longus muscle. So again, it has a tendon that extends to the bottom of that big toe. Remember, the word hallucis should clue you in that this is our big toe that we're talking about. Trying to see the muscle in its entirety, again, we cut away our FDL, we cut away our tibialis posterior, and we can see that FHL. Let's talk about some generalizations of the muscles in this compartment. In terms of actions, these muscles do plantar flexion and some inversion of the foot. Remember, inversion and eversion are according to the soles of the feet. So inversion means you're pulling the soles of the feet inwards or medial, so they're facing each other. These muscles are innervated, in general, they're innervated by the tibial nerve and supplied by the posterior tibial artery. So I'm going to take a minute and I'm going to go through in a little bit more detail these muscles that we just talked about. And I'm going to talk about them individually because we do have some exceptions and we do have some actions that I also wanted to specifically talk about before we talk about the mnemonic that goes with these muscles. So the first muscle I'm going to talk about is our popliteus muscle. So orienting you on this picture, we have medial on this side and lateral on this side. So we can see this muscle attaches on that lateral aspect of the femoral condyle and the lateral meniscus of the knee. And it extends more medially and attaches on the posterior tibia. This muscle is supplied by the popliteal artery and it's innervated by the tibial nerve. So its main actions, again, muscles will only exert an action on the joints that it crosses. So here it crosses the knee joint. So its main action is to flex the knee and perform internal rotation at this joint as well. So essentially it's a way of saying that it will unlock that knee joint. So a mnemonic that I remember, popliteus unlocks the knees. So if you've ever had someone do this to you or you've done it to someone where you kind of like nudge them, it doesn't even have to be a full kick. If you just give them a little nudge behind the knee, just with like your foot, maybe you're just sitting down, they're standing up, you just kind of like push your hand, you kind of help that sort of contraction of that popliteus muscle and their knee will just like boom, like they'll just buckle. That is you activating their popliteus muscle, and you can always just inform them like, hey, I was just testing to make sure that your muscles were working fine. And you can use that as a learning opportunity. Probably to never do that again, but it's still fun to try with a friend. So the next muscle we're going to talk about is our flexor digitorum longus, or our FDL. It is supplied by the posterior tibial artery and innervated by the tibial nerve. For main actions, we're going to look at the joints that this muscle crosses. So we can see that it crosses the ankle joint, so that means that it will aid in plantar flexion. It also crosses near that medial malleolus, which will come into play a little later on when we're talking about a mnemonic. But because it's crossing at the ankle joint near this malleolus, it will also be involved with inversion. The tendons of this muscle also crosses the phalanges in the foot, so it will flex the lateral forward toes. The next muscle we're going to talk about is our tibialis posterior muscle. So first, we will, like I said, we'll cut away that FDL that we just spoke about in order to see the entirety of the muscle belly of that tibialis posterior muscle. It is supplied by the posterior tibial artery, and it also gets some contributions from the fibular artery as well. It is innervated by the tibial nerve. And when we talk about main actions, again, it's crossing this ankle joint, which means it will do plantar flexion. And it's also crossing it near that medial malleolus, so we will have inversion of the foot as well. Finally, we have our last muscle of the deep posterior compartment of the leg. First, again, to identify it, we're going to have our FDL cut away, our flexor digitorum longus. We will also cut away our tibialis posterior muscle in order to see this flexor hallucis longus muscle, which again, it has the muscle belly on the posterior portion of the tibia with the tendon wrapping around the medial side of the foot and that tendon extending to that big toe. Remember, hallucis, you should be thinking big toe. This muscle is supplied by the posterior tibial artery, and it also gets some contributions from the fibular artery as well. It is innervated by the tibial nerve, and for main actions, we'll see that it crosses that ankle joint, so it will do plantar flexion. It crosses it near that medial malleolus, so it does inversion. And it crosses the phalanges of the big toe. So we know that it will flex that big toe. So let's take the last three muscles that we talked about and discuss a mnemonic that can help you remember these muscles and be able to identify them well in lab. So the view we're going to look at is a medial oblique view where we've essentially taken the leg and kind of turned it a little bit so we can see some of the medial aspect of the tibia. The mnemonic is Tom, Dick, and Harry. So it works by first identifying that medial malleolus on the tibia and working posteriorly from there to identify the structures. So the T in Tom stands for tibialis posterior. The D in Dick stands for flexor digitorum longus, or FDL. Our A is our posterior tibial artery, and the N is our tibial nerve. And finally, the H stands for our flexor hallucis longus, or FHL. I just wanted to note sometimes there's a mnemonic that goes Tom, Dick, and a very nervous Harry, so that way you can identify the vein that also runs in this neurovascular bundle. I just never actually learned it that way, and sometimes in lab the vein gets removed or cannot be well identified for whatever reason during the dissection process. But just be aware that if you do see three vessels running in between our FDL and our FHL, then it's probably the vein nestled in between this artery and nerve. So it's really important to use this mnemonic right at that medial malleolus and not above and not below, because at this medial malleolus, this is the exact order that you will see these structures in. That's also important because for our FDL, another part of the mnemonic is Dick is a dirty double crosser, and he crosses both Tom and Harry. So just above that medial malleolus, we can see that our FDL crosses our tibialis posterior muscle. And then later on in the foot, on the underside of the foot, our flexor digitorum longus crosses our flexor hallucis longus. All right, so thank you for sticking with me so far. I am almost done. I just wanted to leave you all with a very quick learning aid that I found very helpful when I was learning about leg muscles. I know we just tried to group them into different compartments, and that works, but it still might seem like it's a lot. So this learning aid really helped me try to compartmentalize all the different actions of each of the different muscles in a way where I didn't have to memorize. I could just learn how to use this learning tool and just reproduce it very quickly, either on exams or when I'm looking at muscles in lab and trying to quiz myself or my friends. So how it works is we're just going to make it very simple, and we're looking at a cross-section of the ankle. So here we have our medial malleolus and our lateral malleolus. So we're looking at the left ankle joint. And we're just looking at a cross-section of that. So if we are to draw a line horizontally between the malleoli, we can essentially split this ankle joint where anything in front of this line is the anterior portion, and that is the posterior portion on the underside. So if we've made this split, we can say anything that is anterior is a dorsiflexor, and anything that is posterior is a plantar flexor. So remember, plantar flexor, that's your toes towards the ground, or you're planting your foot so the ball of your foot is on the ground. And dorsiflexor is the opposite action. It's bringing your toes up to your shin. So now we can make another split at this ankle joint and split it down the middle. And we can say anything on the right side towards the medial malleolus does inversion, and anything towards the lateral malleolus does eversion. So remember, inversion and eversion is the direction that the soles of the feet go. So inversion means the soles of the feet go inside or towards each other, and eversion, the soles of the feet go outside or away from each other. So if we've made these different quadrants in this ankle joint, we can group some actions where anything found in this first quadrant does dorsiflexion and eversion. In our next quadrant, they do dorsiflexion and inversion. Then we have plantar flexion and eversion, and plantar flexion and inversion. So all I'm doing is pulling out what we see in anterior versus posterior and what we see in medial versus lateral, and that's what's going in each of the different compartments. So why this is important to make it? Because if you can look at where the muscle tendons cross at this ankle joint, then you can figure out what the actions are for each of those muscles. So let's apply that with the muscles that we just learned. So let's first talk about our superficial posterior compartment. So remember, we have our gastrocnemius and our soleus muscles, and those attach at the same Achilles tendon. They attach together on the Achilles tendon or the calcaneal tendon, and that attaches midline. So those two muscles do not do eversion or inversion. They just do plantar flexion because they just go right down the center. They are not in either one of these quadrants. Now let's talk about our deep posterior compartment. Remember, that was our Tom, Dick, and Harry, and those tendons run right behind that medial malleolus. So because they're all in this quadrant, those three muscles do plantar flexion and inversion of the ankle joint. Now let's talk about our anterior compartment. We have our tibialis anterior, extensor digitorum longus, our fibularis tertius, and our extensor hallucis longus. So of these four muscles, our tibialis anterior does dorsiflexion and inversion. Our extensor digitorum longus does dorsiflexion and eversion, along with our fibularis tertius, if it's present. And our extensor hallucis longus, for the most part, the tendon is midline, but it does, at the ankle joint, it does slightly shift medial in order to get to that big toe. So because it does go slightly medial, it does slight inversion, but it mostly does dorsiflexion. Finally, let's talk about the lateral compartment, where we have the tendons that run behind the lateral malleolus. So that is our fibularis longus and our fibularis brevis. Because they are both in this compartment, those two muscles do plantar flexion and eversion of the foot. So I hope that by being able to visualize this little chart and being able to identify where these tendons cross the ankle joint, it might make it a little bit easier for being able to sort out the different actions of these muscles. Definitely watch this over again a couple of times and kind of like have this by you as you look at the muscles in lab, and maybe that'll help it click a little bit more. If this just seemed too busy, then just don't worry about it. But I did find it very helpful when I was a student taking anatomy to learn the muscle tendons crossing the ankle joint in this manner, because it allowed for me to do less rote memorization and more of being able to reproduce this chart very quickly during a test-taking environment. All right, so this is the end of the video. Thank you for sticking with me this long. And of course, I would never let you go without another bad dad joke. This one is not anatomy focused, but I've gotten some people who've been a little like, okay with the bad dad jokes. So I feel like this goes out to all the people that kind of roll their eyes when I tell my jokes, because I make this joke back at them. What do you call someone who tells dad jokes but isn't a dad? A faux pas! All right, now we really are at the end of this video. Thank you so much for sticking with me for this long. I know I was trying to aim for 10 minutes or less, and I literally went 3 times over that. But I hope you found this helpful, and I'll see you in the next video.